Hello everyone, it's me Rose again. I'll be your future radiologic technologist for today, and I'll be assisting you during an interventional radiologic procedure. And for today's procedure, it's called Coronary Angioplasty with Stent Placement. The main imaging modality used is fluoroscopy, or called CR, is which a real-time X-ray imaging technique that helps doctors to see the movement of the catheter inside the blood vessels, as well as the ultrasound, it is to assess blood flow, and the CT scan or CT angiography, which is to evaluate blocked arteries. This procedure is done to open narrowed or blocked arteries in the heart caused by plate buildup or cholesterol deposit. It is when the arteries become blocked, the heart cannot receive enough oxygen blood, which may lead to chest pain, shortness of breath, or even a heart attack. During the procedure, a thin tube called a catheter is inserted through the wrist or a groin and carefully guide towards the heart. So basically, technology is helping doctors be detective inside the blood. Worsening indication may include leg pain or claudication, poor wound healing, bleeding, artery damage, or the complications such as stenosis. For patient preparation, it is very crucial for us to ask the patient for their consent to proceed, take their history, also ask for the allergies, and if they're taking blood thinning medication. Before the procedure, it's also patient are instructed not to eat or drink for several hours. Vital signs or check, laboratory tests may be reviewed. Patient will be asked to remove shively or metallic objects, and after the procedure, the patient will be monitored closely while resting and recovery. And here I will show you the step-by-step procedure. And the supplies first are the stent supplies, angiography supplies. First is the patient in the table. Second is the insertion site, usually the wrist or the groin, is clean and numbed using local anesthesia. Third is the catheter is inserted into the blood vessels and guided carefully toward the heart using fluoroscopy, as you can see in the video. And for the angiogram, contrast dyes is injected to see the blood vessels and to confirm the position itself. And the fifth one is the embolization. Tiny particles are injected through the catheter to block blood flow to the fibroids. And next step is a balloon attached to the catheter is inflated to open the blockage, as you can see there. And finally, the stent may be placed to help keep the artery open and improve the blood flow. Isn't it amazing? And just like that, the heart's traffic jam gets cleared. Now check it is to confirm that the procedure is finally succeeded. Next slide, it is to removing the catheter. With the procedure complete and verified, the catheter must be withdrawn. It's concluded that the patient must be in a recovery, drinking plenty of water, and is encouraged to help flush out the contrast dye from the body. That's it for today. See you in the next one. Bye.